introduce and welcome our guests, Policy Times Chamber of Commerce. I also want to welcome our Secretary, Dr. Ayan Chakraborty. Welcome, sir. And the moment our chairman joins, kindly let me know. Nothing, sir.
Yeah,
So,
he should be on any moment.
Policy Times Chamber of Commerce, since last 4.5 years, almost 5 years now, has been relentlessly and consistently working towards policy advocacy. Our mission is bringing development uh, in the country and in the society. Fundamental pillar of bringing development is policy. Countries or nations which make good policies and implement them are always successful in terms of bringing socio-economic development. So since last 4 years, there are 4 or 5 sectors we relentlessly work and contribute in nation building. One of the areas that we work is healthcare. Healthcare is a very important domain and sector which needs a lot of which has been. I'm just spotlighting our speakers so that now we have recently organized India Healthcare Summit in Siliguri, thinking that Siliguri is one of the important domains or important strategic location of Eastern India, which is connected with Bangladesh, Nepal, Bhutan, neighbor surrounded, and also Bihar. The entire of Eastern India is well connected. Out of the discussion that we did, one of the areas where there was unanimous, commonality and agreement was bringing Ayurveda or care in the north, in this Eastern India. When we did identify that, then there were a couple of suggestions which came out. One of those suggestions was a medical college, private medical college in Siliguri, and a couple of wellness centers, world-class international level wellness centers, and some Ayurvedic medical college. So the journey started from there. And when we started discussing, we got a couple of interested investors and interested persons, business leaders who are interested in establishing and investing into Ayurveda. That was the logic to start off this discussion. And that was the objective to start off. I want to, before I invite our chief guest to deliver or give his remarks, out of the discussion, what we want is we want our investors who are joining us in the discussion and some experts from Southern India who are joining us, or from across Northern India, especially including Ministry of Ayush and some of the medical college, Ayurvedic medical college entrepreneurs and manufacturing company leaders who are joining us from South India, to exchange your view, understand how we can start a Ayurveda center, wellness center, or Ayurveda medical college. What are the prerequisites? What are the requirements? And then how is it commercially viable? What are the systematic reforms that we need to bring in especially when we talk about Eastern India, especially Bengal and Northeast? These two, one state and region, are our focus area. So now, to briefly introduce what our national committee is doing, I will request Natesh Bala sir to introduce and say a few words. Then I will, as a convener of the National Healthcare Committee, I'll request him to speak. Then I'll invite our secretary to speak. Natesh sir, over to you.
Yeah, good evening to everyone here. And I, first of all, thank you, Akram, for this opportunity. And I want to welcome all the dignitaries who've taken the time to be on this show today, and as well as our audience. I can see that, I mean, there are almost 100 people here. I just want to welcome all of you. We started this journey, especially in the healthcare. I've been associated with Policy Times, I think, for about 3 years now. And our mentor, Dr. Shekhar, who's unfortunately no more with us, put us on the path. He was a great advocate of nation building, and he has encouraged us right from the beginning. And whatever we do now, we want to commit in his memory and take it forward. And we had an excellent healthcare summit in Siliguri about 2 weeks ago, where we had a lot of business talks, and we were able to put together a few, investments there. And we are committed. I'm from Chennai Lifeline Hospital. I can see our chairman, Dr. Rajkumar, there. He's also the chairman of the Policy Times Committee, Healthcare Committee. Raj, can you come in and say something? Yeah, I think he's in the theater. Yes. Can you unmute him, Akram? Can you unmute Dr. Rajkumar?
He is co-host.
Hi, Dr. Akram. How are you?
Very
First
well,
of all,
sir.
it's great to see such a well-attended meeting. I would like to thank Dr. Akram for putting it all together. I know that and thanks to Dr. Natesh and Dr. Ayan for co-hosting it so nicely. I know that we have a huge number of people with us. We have people not only from the Policy Times, we've got people from the ministry and a lot of other doctors. I'd like to say a big hello to everybody. Is Mr. Nigam there? Has he come?
Are you joining, sir? Yes, sir. Dr. Cabinet Secretary Upadhyay, sir.
Is Mr. Nigam coming? Is he there? Because I already met him. That's what I was saying. Mr. Narayan Nigam is not there?
Yeah.
Yeah.
Sir,
now I can hear you. I can see.
Honorable Cabinet Secretary G.P. Upadhyay, sir, is with us. Government.
Oh, right. Wonderful. Upadhyay, sir, it's such a pleasure to have you with us. We really appreciate that you're here with us today. And
you.
To all the other dignitaries, on behalf of my very dynamic group of Policy Times people, Dr. Akram, Dr. Natesh, Dr. Ayan, and Dr. Suptan, and the lot, I would like to extend a very, very warm welcome to everyone. Excuse my clumsy outfit. I've just been, I don't know whether Dr. Ayan is there. We've just been doing a difficult cancer stomach of the mother of one of his friends. And the good news is, of course, we managed to take it all out and she's doing well. But it's fantastic to see all of you. Now, the fact you might be wondering why we're doing robotic surgery for cancer stomach on one side, and on the other side, we're looking at traditional medicine. We really believe that, Vaidyanarayana Hari, and that all roads lead to healing. And I'm a very firm believer in traditional medicine. And I think if something can be all right with some traditional medicine, we shouldn't be doing some big surgery for it. So I know that people think that allopathy is equal to antipathy. That is not true. Certainly in our hospitals, and I'm sure Dr. Ayan and Dr. Natesh, both my senior colleagues, will reflect my thinking that we are not only, we don't believe only in allopathy, and we are very, very wide open to participate in traditional medicine. I'll give you a simple example. About 2-3 weeks ago, I'd gone to Kochi to meet Mr. Raila Odinga, who was earlier Prime Minister of Kenya. He stood this time for president and he lost narrowly. He's a personal friend of Modi ji, and his daughter with a degenerative retinal problem had been completely checked at Moorfields Eye Hospital, London, at Agarwal's, at Shankar Nethralaya, and they all said, you can't do anything. He went for traditional medicine. He went to Shankariyam, Ayurvedic eye work, and I promise you, within a month, when I went and saw her, she could see properly, wearing glasses. And those guys were saying, no, we are not happy with this, the doctors. In another 1 or 2 months, we'll throw off the glasses also and get her back to normal. So this is obviously one anecdote. But when I went around the Sridhariyam and that entire institution, it's a 10 or 15 acre institution, only for Ayurvedic treatment of eye diseases. Jam-packed, hundreds and hundreds of patients. So there are so many things that allopathy doesn't know. We are completely wide open. We welcome our brothers from traditional medicine with open arms, and we are very happy to participate in today's function. And I would like Dr. Natesh and Dr. Ayan to take over with this brief introduction. Since there are so many dignitaries and so many speakers, I would like to wait and watch and learn from everyone.
Thank you. Thank you so much, sir. Natesh, sir, a brief welcome remarks for our honorable chief guest, and then our objective of our committee, and then we move forward with the discussion.
Okay. Thank you. Thank you, Dr. Rajkumar. Upadhyay, sir, good evening to you. Thank you for joining us. And last week, 2 weeks back, we had a summit, healthcare summit. It started in a very small way, ended up in a very big way at Siliguri. I was there personally. We were very honored to have the district magistrate there, who happens to be from our home state of Tamil Nadu. And, he's been there for 10 years in Darjeeling, and he was wonderful in welcoming us and promised us all help. So Policy Times Healthcare Committee is going to do a lot of work in Bengal, especially. So we want to, we've already been there in Bengal. Dr. Rajkumar and I have visited it many times. We also tied up with a medical college called Santiniketan Medical College there. Our aim is to bring technology in medicine, at which we are very good, into the Northeast. That is one of the first aims we had there. And then as we started discussing with more and more people, we got requests for also supporting in Ayurveda. That's how this meeting is coming about. Like Dr. Rajkumar said, we are very, very firm believers in what we call holistic medicine, sir. We are not, we truly recognize and understand our limitations of allopathic medicine. Indeed, I have personally witnessed many miraculous transformations in conditions, chronic conditions like autoimmune diseases, where we don't have any answer at all. But Ayurveda and other natural sciences seem to play a huge role. And we are indeed, a few days back, I was talking to Rakshmar, I met Dr. Manavalan, who is the director of the state in Tamil Nadu Institute of Yogic Sciences and Naturopathy. He was very, very keen. He is a wonderful man who has got tremendous knowledge in Ayurveda, and he is very keen to start Ayurvedic centers in all hospitals. And we welcomed him to Lifeline, and now we're talking about placing also an Ayurvedic doctor at a hospital. So with these few words, I just want to say that I think we should combine and bring back the traditional system of medicine as in addition to allopathy, because I don't think one can replace the other. I think we should combine both these systems and ultimately ensure that the patient is benefited from the immense knowledge that both these systems have to offer. So at the higher level, Policy Times, the Healthcare Committee, we want to assure everyone here, we are going to use all our connections, all our resources to facilitate, act as super connectors to different groups, and see how we can put together and evolve a system of medicine which reaches patients well and takes care of the problems. With that, I will hand it over to Akram again. Akram.
Thank you so much. As part of our committee, our secretary, Dr. Ayan Chakraborty, joining us, also COO of Shantiniketan Medical College, West Bengal, and also one of the very dynamic leaders in terms of facilitating, bridging healthcare collaborations between states and also between different verticals of healthcare. Small welcome before I invite our chief guest to speak.
Yeah, thank you, Mr. Akram. Thank you, sir, and Dr. Rajkumar, sir, and Dr. Natesh, sir, to have already with us who are there, enormously waiting for, the people, all delegates, all dignitaries, they're all there. With due respect to all, just I want to highlight, I want to focus certain points, like what are things, what we did, actually, what was our plan when we started this kind of thing for West Bengal development. So the theme was to have a proper investment in the areas of the North Bengal where there are the scopes to go for, open scopes. Like we have come with certain phases of Ayurvedic college, certain phases of medical college, certain phases of like nursing and paramedical college, certain phases hospital. They are asking support from different areas, different states, say for Chennai, say for other hospitals, for improvement of their health, certain pharmaceutical manufacturing companies to come over there and to sit and to manufacture. So in these different projects, we got some certain investors, we got certain areas where we can expand the scopes of having this Ayush system completely in North Bengal. So we started working on that. So what happens out of that policy summit in Shiliguri on 15 December, we have got certain projects, certain investors are very much interested for going through that. So now the question was like one Ayurvedic medical college, say for, some investors who are asking, they came with a question that I want to start one Ayurvedic medical college. So what are the prerequisites? Certain pharmaceutical company, they are asking some prerequisites, certain pharmacy college, somebody came to us over the same day, and they are having a plan to open a pharmacy college. So like that, these colleges, this medical college, Ayurvedic medical college specifically, the prerequisites, we wanted to clear it up, clear discussion about this. So we searched out. I mean, the best possible people of country we came off. And today with us, all the people are there. And I personally, being a radiologist, I have seen the Ayush, how it helped. I was in Kerala for 6 years. So there I worked with certain stalwart people I have seen. And I have seen how fistula they treated it out in Ayush. How different types of diseases like spinal problem, orthopedics issues, congenital problems, they used to get cleaned up by our Ayurvedic medicines. And I had got opportunity to work with Dr. Rabindranath Tripathi, Dr. Nambudiri, and all the people I was having. So, I mean, these people knows me. I also knew their work and all those. So today, I mean, when we got the opportunity to expand the North Bengal in putting this kind of Ayurvedic medical system, Ayurvedic pharmaceuticals over there, pharmacy colleges. So we are, I mean, very eagerly waiting for the prerequisites. What are the prerequisites? How we can plan? How many days we can develop? How many hospitals we require? Or what is the things we required? What are the system we require? So today we came with this summit, with this meeting. We want to specifically highlight all the investors who are ready to invest over there for Ayush, and with the system director, health secretaries, honorable. So these all people are there. So today, by this discussion, we should have a complete follow-up of the system, and we should start this kind of projects as soon as possible. This is our Policy Times main mission. And I think today, after this meet, we can definitely land it up with some good projects within maybe within a month or certain. Thank you so much. Now I will be covering, again, giving to Mr. Akram about the next part.
Yeah, thank you. Thank you so much, sir. Indeed, very short and brief. Before I invite Honorable Secretary, Cabinet Secretary, sir, to speak and to deliver your chief guest remarks, I just want to tell to our audience that we apologize. We only have 100 people's window in Zoom. We cannot take more than 100. I would request my team to kindly share the Zoom, our Facebook and YouTube live link to all the participants who are willing to join. I understand there are a lot of Ayurvedic doctors are joining from Nepal. We have a very big delegation because Nepal and India collaboration is also one of the factors that we want to discuss. Now, before I hand over and request our honorable chief guest to speak, sir, the purpose of this meeting has already been briefed is that there are a couple of serious investors here joining us in this Zoom meeting who are willing to invest into a medical college, private medical college, and there are a couple of serious investors. I would not name it because it looks a little glamorous. There are a couple of interested entrepreneurs who are willing to start their wellness center, and the end will be so from wellness to hospital, Ayurvedic hospital, and then from there to Ayurvedic medical college. And our experts are here who will brief us and guide us how to go ahead on that. This is the objective, and so we want to actually bridge the South with East. South has the expertise, East has the demand. So we want to collaborate or club between South and East so that there is enough amount of knowledge exchange, technology exchange, experience exchange, and building a very collaborative structure between both South and East so that we smoothly build Bengal, especially the Northern Bengal and Northeast, as the Ayush tourism or Ayush tourism, hub of India. And it has all the potential. And our advantage, as you know very well more than me, is that we are surrounded by Nepal, Bhutan, and Bangladesh, which gives us an immense competitive advantage to become one of India's famous and prominent hub to be a medical hub, basically, or healthcare service providers hub. Now, to introduce our chief guest, Shri G.P. Upadhyay sir is the Honorable Cabinet Secretary of Government of Sikkim. Sir is one of the most dynamic leaders that I have ever met. When I met him for the first time, the kind of ideas, the kind of activeness, and a kind of simplicity I found in his approach was really attractive. He was very to the point and simply elaborative. He explained everything what is required, but it was very simple, so that any layman can understand that. Sir has been Secretary General before being the Cabinet Secretary. Sir has had a very long tenure to serve the government of India, the country, and government of Sikkim. Sir was Secretary General at FIO, Federation of Indian Export Organizations, where Sir led a lot of, he introduced a lot of exhibitions to promote India's export. Then Sir was Commissioner and Secretary after that for around 12 years. Then Sir was also Commissioner with Government of Sikkim. Sir became Additional Chief Secretary, serving education, tourism, civil aviation, commerce and industries. And Sir was also Principal Secretary in charge of tribal development, women and child development, minority affairs, social justice and empowerment. So a long tenure serving the people of Sikkim and people of India. I would request our honorable chief guest to kindly deliver your inaugural address, and then we will discuss the business discussion. We'll start the business discussion.
Thank you, Akram. I think I'm audible.
Yes, sir. You're very much
yes,
audible.
Okay, so all the distinguished people who are here in this important meeting, and I wish a very good evening to each and everyone. And I'm humbled by the introduction given by Akram. Actually, I was lucky. I got this opportunity to serve in the IAS, and I have been in Sikkim and Delhi and UP, serving in different capacities. And I have had the opportunity of serving in different departments, which gave me a very good exposure, as well as in the export sector. Now, as it happened, there was a health summit in Siliguri, which was told to me by Akram, and I was very happy to know about the proceedings of that successful meeting in Siliguri. Sikkim is a small state, and but it is known for its good governance, good policies, and cleanliness, and law-abiding citizens. So there are a lot of positives about the state which are known to outside people. And we have had a good development in the field of education, especially also in medical education. We were the first in India to enter into an MOU with Manipal Group to set up a public-private partnership university, which became a role model for the private university revolution in the country. And all of you know that there are now hundreds of private universities. So that was the first time that any state started a private university. And now we have got a medical college. Of course, Manipal Group is running it for 150 seats. We are setting up. We are in the process of setting up a bigger medical college in the state sector also. We are positioning Sikkim as a very green investment destination for in few of the niche areas like education, skill development, in case of agro processing, because it's an organic state, perhaps the only one in the world, and also in the field of IT, and then some other related fields. So basically, we already have a large number of pharma companies in the state, thanks to various incentives being offered by government. So when this information came to me through Akram that there is a online meeting regarding this Ayurveda and naturopathy and all that, I immediately told him that Sikkim is positioning in a big way as a very favored destination for Ayurveda and a health resort in the state. I mean, few of them, because I have seen many of them in Kerala. I have seen them in Bangalore, in other places. Patanjali is doing in a big way. I feel Sikkim has got the right climate, the right kind of clean air and water, and there are some very good locations which are available for setting it up. And government is all willing to support in whatever way. Government of India is coming out with a new policy which will give tax incentives to people, as well as capital subsidy to the people setting up such ventures in the Northeast. Sikkim is part of Northeast. So we would be very happy if we can work on a proposal to set up an Ayurvedic medical college, because we already have an allopathic one. And what I like the most about today's deliberations was that uh, uh, before me, the eminent doctors who spoke briefly, that they said that we are not against naturopathy or Ayurveda. Actually, allopathy and naturopathy or Ayurveda should complement each other. They are not in competition with each other. Where the other one doesn't work, the next one works. The next one doesn't work, the allopathy works. So I think it's a combination, and ultimately the patient should benefit. The patient should get the benefit of the either Ayurveda or allopathy or whatever. So we would be very happy to have such kind of proposals coming to us. In the month of April, first week, we are having a summit where we would like to invite some of the people as our guest to the state, and they will get a chance to meet all the people there, prominent people, and honorable CM and governor, and of course will be able to take the proposals forward. So I once again, it's my privilege to be part of this deliberation, and I am here to basically learn from all of you. Whatever I can do from my side in terms of promotion of these things at the state level or at national level, I am always available, and I wish a very successful deliberation in the meeting. Thank you so much.
Thank you. Thank you so much, Honorable
Thank you,
Secretary,
sir.
for your very short but very impressive, speech. You have highlighted how Sikkim, I mean, one of the secrets of Sikkim success story is that it is very simple, straight, and to the point. Sikkim, it's not very complicated. It's very simple. The climate is very welcoming, not only in terms of weather. I don't know whether you're able to see me or not, because I'm not able to see myself in the frame.
We can see you, Akram.
We can see you.
Okay. So the second thing is the climate is, the people's behavior is wonderful. People are very welcoming in the state. So if any industry leader goes there or wants to invest, whether this is political leadership, bureaucratic leadership, or even common people, they are very welcoming and forthcoming in terms of investment. So we would be also very happy to help Honorable Secretary Sir to make the event a grand success. And also we would be extremely committed to bring serious investors to the state, so that we make Sikkim, it is already a big business hub in terms of healthcare investment. Now we can also attract investment in education. We can attract investment in many green technologies. We can bring investment in this Ayurveda, as this is also one of the core areas where Honorable Cabinet Secretary Sir is focusing. So we would be extremely happy to support you and help you, sir. Now we to move ahead, and we'll be very happy, sir, if you are with us for a little more time, or will be always forthcoming in terms of giving you some suggestions as to what we achieve from the discussion and what we can bring in for Sikkim. So to move ahead, I will request Nate sir to now take forward the discussion. We will now continue the business. We will start the business interaction, where our honorable speakers from various verticals have joined. Nate sir, if we can briefly introduce our honorable speakers, and then we will basically, I will hand over the mic to you. So the session that we are about to begin today, and the honorable speakers we have very shortly, I think we already have, or very shortly we will have Dr. Mukhtar Ahmed Kazmi, the Honorable Advisor of Unani, Ministry of Ayush. We will also have Dr. Dinesh Katoch, the Honorable Advisor at Ayurveda at Ministry of Ayush. I think Katoch sir is also here. I will, after my speech, I'll just start adding them in the group. For unfortunate reason, we could not have our Honorable Health Secretary of Bengal, because he is in the hospital with his mother as we are having the healthcare summit. So also the same is with Professor A.K. Singh sir, Vice Chancellor of Mahayogi, because he is with his wife in the hospital for one leg fracture surgery. Ramanathan sir, we already have. We also welcome Professor E. Kuni Raman sir, Honorable Director of MBR Ayurveda Medical College, one of the stalwarts, business leader as well as medical professional. Ramanathan sir needs no introduction. He is the secretary and founder member of the Ayurveda Medicine Manufacturers Organization of India. We also have a very honorable Dr. Jairam Hajra sir, former director of NARIAD and CRIHR, playing a very active role in Ayurveda policy advocacy. We have one of the rising entrepreneurs of South, Dr. Narasimhan Jami sir, having medical degree, but absolutely passionate about Ayurveda. We have from the government, manufacturing, Ayurveda manufacturing company, we have Kanaya Mandal sir, who is the plant head of IMPCL. We have Professor Dr. Ravi Narayan Tripathi sir, one of the expert and veteran on this space of Ayurveda. He is the vice principal of Amrita School of Ayurveda. He will share his view. And then as a women leader, we have Priti Madhava ma'am, the partner of Rasayana Ayurveda Center. Ma'am is also the state Ayurveda State Council chairman of Wiki. And then we have many other speakers. Vijay Kumar Shah, one of the industrialists and business leader of Daj Siliguri, not Bengal, and many others. So the introduction will go on. Now, without taking any or wasting any more time, I will request Natesh sir to kindly start the discussion. We will invite our speakers to speak for 5 or 10 minutes. Sorry, I forgot to introduce. We have Dr. Pradeep Gyanwali sir joining us from Nepal. Sir is a veteran medical practitioner, but a passionate Ayurveda researcher. And sir is actually leading the traditional medicine practice movement in Nepal. And sir was recently in India. He also joined our program. He wants to extend the collaboration between India and Nepal in the field of traditional medicine and Ayurveda. So with this introduction, I will hand over the mic to Dr. Natesh Bala.
Thank you, Akram, for that lovely introduction for everyone. And before I introduce the speakers, I will just say a word of thanks to our Honorable Mr. Secretary, sir. It was very nice. Whatever you said was so comforting and encouraging, and Policy Times will strive to work along with you to see how we can promote Ayurveda in the state of Sikkim. Without further ado, I will now introduce Dr. Mukhtar Ahmed Kasmi, Advisor, Unani, Ministry of Vish, Government in India. Sir, I welcome you to start your talks. Let's go in order. And if you can keep your speech to about 3 to 5 minutes, then we can have a small question and answer session, and then we'll go to the next speaker.
Sir, I don't see Kazmi sir has joined yet. So maybe we can start with our speakers who are...
okay, sure.
So maybe, and then I'll tell you how to go ahead. So maybe we can start with...
Professor, yes. Hello, can we?
Yeah. Sir, can you unmute yourself? Okay, sir was actually learning technology.
Okay, so can we ask Dr. D. Ramanathan to start off? Secretary and Founding Member, Ayurveda Medicine Manufacturer Association of India. Moy? Dr. Ramanathan?
Madhuraman. No, I don't see him here. So, yeah, or Ravi Narayan Tripathi sir can give the...
Please. Professor Ravi Narayan, you are muted, sir. Can you unmute, please?
No, Jairam sir is unmuted now. Jairam sir, you can continue if you are there.
Dr. Ravi Narayan Tripathi, sir, before starting off, I just want to introduce for just a short seconds introduction. He is a superb man I have seen ever. At least I visited him because I know him. I have seen him to work. So, I mean, he is excellently treating fistulas, I mean, in that system. So what previously our chairman was talking about that Ayurveda system is not like some other system rather than allopathy or something, some competition and all those. It's not like that. So again and again, it's proving that the Dr. Tripathi sir was superbly treating the spinal issues, ortho issues, and fistulas. So I have seen him like more than very good and well known allopathy people. Dr. Rabindranath Tripathi sir was treating the patient like just like minutes. So I've seen him. So he is here and he wants to give his best advice for how to expand the Ayurvedic system completely Ayush over expansion in North Bengal. So he is with us now, and just I'm requesting sir to come over here.
Dr. Rabindranath, can you start, please?
Yeah. Sir, actually, I am waiting because Hajra sir is also there, and he told that Hajra sir will start. That's why I am waiting. Anyway,
Okay.
So it's all right. So my humble pranam to all the dignitaries, especially to GP Upadhyay sir and Mr. Akram, and Dr. Ayan has given a very good introduction for me. Rather, it's my honor to be here. And the thing is, I am not a businessman. Actually, I am throughout my life, I am in teaching. So I am a professor and I am guiding the PhD and PG students. Simultaneously, I am also a physician. So what Dr. Oyen sir told, I am practicing mainly fistula and orthopedic cases. Anyway, that we'll discuss later. And what our Upadhyay sir told, that if it is integration, that integration does not mean that to replace one pathy and to adopt another pathy. Rather, it should be patient-centric. Wherever there is some problem in the patient and whoever can overcome that pathy has to be started. So it is not like replacing. For example, what sir told in fistula in ano, actually we are having 18 different OTs at Amrita Institute of Medical Science. And once in a while, or whenever there is some patient, they are collecting some fistula patients, and I used to travel from Kollam to Kochi to treat all those cases. Because there are so many different methods, like you might be knowing, because so many doctors are there, so they know about different treatment of fistula. So many tremendous advancement is there, but still some tracks are like so much fibrous that the ultrasound probe will not enter into that, so that they cannot do the warp technology also. So in those cases, our treatment, like Kharasutra treatment, is very good, and we can give a better outcome. So this is actually not according to the topic. What Akram sir told me day before yesterday, that I have to give a keynote address. So I have prepared a very small PowerPoint presentation, some 6 to 7 slides. So and I want to show that particular slide because there may be so many people, those who are not belonging to this traditional medicine, or those who are not doctors. For them, I think it will be a little bit, it can give some more highlights or more lights to those people. That's why just allow me to share my slides.
You can share, Doctor.
Yeah. So actually, initially I have told that I am not a businessman, but still I can give some highlights, and whatever the objective you are having to start a wellness center or to start a hospital or to start a medical college, in that concern, being I am working as a administrative post in the Amrita School of Ayurveda. That's why I can also give some of the clarity to that. So today actually the topic is traditional medicine and global health. So when we are telling about global health and traditional medicine, first of all, we should know that what traditional medicine means. Some people tell this traditional medicine as alternative medicine. But here I can highlight that it is not an alternative medicine, rather it is the native medicine. So which has been propounded, which has been started in India since maybe 5,000 years ago. And this is the most ancient and documented medical system. So, and I can tell, if we are telling about this traditional medicine, then so many other branches may also come, like Ayurveda, Unani, acupuncture, Siddha, so many different system may come. But being a person of Ayurveda, I can tell that this Ayurvedic system of medicine is very good to treat almost all types of chronic disease. So that is only a little bit thing. Another, if we are mixing with this global health, then you people may be knowing that whenever we are doing some functions, whenever we are doing some spiritual function or some cultural function, some of the rituals, at that time there will be a swasti vachana, like Sarve bhavantu sukhino, sarve santu niramaya, sarve bhadrani pashyantu ma kaschid dukkhavag bhavet. So this is a very common Sanskrit sloka used in day-to-day functions. So from there, that means what I mean to say, in our Indic thought, in the Indian mythology, if we are going, then it starts with Sarve bhavantu sukhino. So here there is no one is not there. Always we are thinking about the community, always we are thinking about the people. And that Sarve means the global health. So that's what I am telling, that our Indian thought or the Indic thought always tells about the wellness and the health and wellness for all, not for a particular individual, rather it is for all. So you might have heard about Dr. M.S. Baliathan. So he used to tell, he has written so many books on Ayurveda, being a very good cardiologist also. He has mentioned, the legacy of Susruta, the legacy of Charak, like that book he has already written, which is coming under these bestsellers. So before going to do anything, first of all, we have to clearly understand what is traditional medicine and what is global health. So traditional medicine, there is no need to tell anything about this traditional medicine, because you know that the skill and practice based on experience or indigenous, or which runs from generation to generation, which which is treated by means of different herbs, plants, minerals. All those things are coming under this traditional medicine. And Ayurveda is one part of that, which is the mostly almost all types of disease are mentioned in this Ayurvedic text, and we can treat almost all types of disease also. And when we are coming to this global health, at that time global health is also it is not a very small term, rather it is a very big term, we can tell, where the research, study, practice, whatever it may be, always the priority should be given towards improving the health status. So, and when we are going to when we are going further, then we can tell that actually now this is the need of the time. We have to start and we have to do something. And Ayurveda has a greatest potential to do all these needs of the global health. And there are because in the month of April, the Global Center for Traditional Medicine was already established, and during that period you might have heard about this. Why it become so much prominent, or why it started, why Government of India thought to start this Global Center for Traditional Medicine, because now it is an integral resource of the health from centuries, and around 88 countries and more than 170 member states, they are using this traditional medicine. And though till now it was not highlighted and the people have not realized the potency of this Ayurveda or this traditional medicine, that's why now it become very much essential to collect the data and to highlight and to promote this one. So and we have to think about different global health issues also. And those health issues, if you can answer, then that will be a great help towards the propagation of Ayurveda, propagation of the traditional medicine, and we can achieve the global health also. So there are so many global health issues, but if the more important things we can highlight here, like pandemics. So pandemics, there are every year there are new emerging pandemics are coming, and there are too much of threats to this human being. And here the health education and herbal practices, by that we can overcome. So all these type of issues, I can tell only highlights of these issues, like some environmental factor, pandemics, economic disparity. So this economic disparity in the healthcare, there may be so many people, those who may not able to get all types of healthcare facilities because of their poverty. So business, when we are doing one business, at that time that business, if we start, then that may also be helpful to overcome this economic disparity. Then some political factors may be there. So then non-communicable disease and animal health, all those things are also coming under this global health issues. These NCD and pandemics, all those things you might have seen during this COVID time, how the Ayurveda and Ayurvedic Kadha and all those things have done a tremendous work for this COVID-19. So if we are thinking about the solutions, then to ensure the healthy lives and the promote well-being of at all ages, so many different avenues are there, like Dinacharya, Rutucharya, holistic health, herbal medicine, periodical purification by means of Panchakarma, compatible food and nutrition, like that. So many, and yoga, so many things are there by which we can overcome all these global health problems or global health issues. So for that opportunities, if we are thinking, then we have to think about the fundamental health sector needs. So whatever the fundamental health sector needs are there, if we can do some improvement on that, then definitely we can reach up to our goal. So for that, these are the opportunities I have just quoted few of them, like educational institutes, wellness center, pharmaceuticals, quality control lab, research and analytical lab, health centers, super specialty centers, like one of the speaker was telling about the Sridharyam hospital, which was established in Kerala. So that is a specific for a particular disease only it has been established. Then other than that also we have to run through so many different types of research, fundamental research, RCT, all those things are required. But when we are doing the discussion on this business, so this business, actually I can give a quote here that the global goals are in the business only, and the global goals simply cannot be achieved without business. Though there are core operations, financial commitment, employment network, all these things are there. So many investors may be there. They may be thinking about how much finance is required to start a hospital, how much finance is required to start a health center, how much area of land is required to start a college, and what are the infrastructure we want to start. All those things can be discussed in slowly. In a single meeting, we cannot define all these things. So I can tell you that one website is there from NCISM and CCIM. One ccimIndia.org.in, one website is there. In that website, everything is mentioned. Whatever the infrastructure is required, what are the minimum standard of regulation is required to start a college or wellness center, and how to apply for that, the application format, everything is mentioned there. Only some commitment, some committed people is required to start the progress. So by this only I can conclude my talk, because there are so many people to discuss about all these things, and some question answer will also be there. So finally I can tell, so Lord Jagannath may bless you all. The whole world is one family. Vasudhaiva Kutumbakam, and Loka Samasta Sukhino Bhavantu. Thank you.
Thank you very much, Dr. Ravinarayan Tripathi. That was a very, very lovely overview of traditional medicine you have expounded to us, and very informative. Thank you, sir. We'll come back to you with questions after the other speakers have spoken. Can I invite Dr. Jairam Hazra to talk next? Dr. Jairam?
Yes. May I
Yes,
audible?
sir. Yes, you are. Please carry on, sir.
Namaskaram. Very good evening to you all. All my respected dignitaries attending to this meeting. First of all, I pay my heartiest thanks to Dr. Ayan Chakraborty and Akramji, for whom today I attending this meeting. Although for a long time I was not in touch with this other research organization or education. For last 2 years, I retired from my service. Out of 30 years service in the CCRS, Central Council for Research in Ayurvedic Sciences, what experience I gained, that few important points I would like to highlight today. First thing is, we have to see the quality. What Dr. Ravinaran Tripathi giving a good deliberation. Actually, I wanted to say many things about the quality control, the establishment of all these things. But what I want to say that before establishing any college, any pharmacy, any medicinal plant garden, any laboratory, R&D, because R&D is most essential for nowadays to reach in the global market for business purpose. Although I am not a businessman, I am purely technical person, postgraduate in Drabogun, which is medicinal plant specialist. Anyway, for last 30 years service in my CCRS, what I observed that we need a quality college, quality teachers, quality medicine, because few pharmaceutical companies for their business, they are preparing the medicine without maintaining the quality. Even sometimes we observe that for simply a Chyawanprash, a good immuno producing medicine, Chyawanprash 75% quantity having the amlaki, but few companies, reputed companies, I don't like to take the name, but in my experience, what I observe that instead of amla, they are using some potato and some other things. So how the quality of Chyawanprash will maintain? So if we want to take the desired effect from the medicine, definitely we have to maintain the quality medicine, quality plants for cultivation, preservation, and we have to take the help of modern medicine, the tools, parameters, various technology or modern science. Without the technology, tools, and parameters, even we cannot help the Ayush systems. That's why I always say, first to maintain the quality of teaching, I mean teachers, then quality of hospitals, then maintain the quality of the medicines which we are using for the patients, so that we can get a good Ayurvedic systems. And for that reason, if we maintain the quality, then we can reach up to global market without any hesitation. But without such, it is impossible. And what Dr. Tripathi also told, it's my first time, and what I think that we should sit together face to face, and various opportunities are there for Ayush system, not only Ayurveda, Unani, Siddha, Yoga, naturopathy. So if we establish Ayurvedic hospital, Ayurvedic college, but definitely we have to see the policy of the central government. I mean, policy of the Ministry of Ayush, what their policies they are adopted for college, for hospital, and for pharmacy, etc. So definitely, I don't like to say more about the all these things. So next time I'll say in details. Thank you to all.
Thank you very much, Dr. Pradeep Hazra. Thank you for reminding us that it is important to maintain the quality and of teachers, hospitals, as well as the medicines, and for sharing your knowledge about different plants that you spoke about. We will definitely take all this into consideration. And for your information, sir, we are working very closely with various groups to set up Ayurvedic colleges. We are facilitating definitely one in the Northeast, and with our Honorable Secretary Upadhyaya sir's support, we hope to set up one in Sikkim as well. Thank you, sir, for your.
Presently, I am a retired person. I can always I am with you, with your organization. No problem.
Thank you, sir. We look forward to your advice when we start these ventures. We will reach out. We'll reach out for sure, sir. Thank you. So, can we have Professor Kunni Raman if he's available now?
Actually, his audio, he is there with video, but he's not able to come with audio. His audio is not working. So we can invite Jami sir and Kanaya sir.
Let me introduce Dr. Narasimhan Jami. Sorry, go ahead, Akram.
Yeah, so to take the international perspective, Pradeep sir will take, but Jami sir and Kanaya sir will give the industry perspective now because they belong to industry. Let us have the industry perspective.
Fantastic. Dr. Narasimhan Jami, who is the CEO and director of Jami Pharma, is a medical doctor, but Jami Pharmaceuticals is a 125-year-old organization. It's a third or fourth generation. He will tell you more about it. Jami, you're on.
Thanks, Dr. Naresh. Nice meeting you here again on this forum. It's a very wonderful surprise. So, thanks to the Siliguri meeting, Dr. Naresh and I and our colleagues have set up a very good collaboration where we've actually done what Dr. Rajkumar has said, a collaborative effort in trying to use both the allopathic as well as the Ayurvedic ways to address human health. Now, since this is a Policy Times Chamber of Commerce session, I want to talk about policy, right? So there are three very important things that I want to touch upon. The first one is R&D funding, right? R&D funding is very, very critical for any field, for any science to move forward. And Ayush needs R&D funding. And one of the lacunae as far as R&D funding today, as the situation is today, is that there is only funding available for classical Ayurvedic preparations, which I don't think is the necessary is the right way to go about encouraging Ayurvedic scientific growth, because Ayurveda is a science, a very pure science. And I'm a scientist. I have a postdoctoral fellowship from Stanford in molecular pharmacology. The people who are going to decide on the funding merits of any proposal should be scientists, along with Ayurvedic physicians. The Ayurvedic physicians should be the ones vetting out the Ayurvedic potential of the project, whereas the scientific merit of the project should be actually decided by scientists who are running it. It has to be a collaborative effort. So that is as far as the funding is concerned. The second thing is the opportunity from the business perspective, from the industry perspective, is Ayurveda has one of the most facile and a comprehensive solution for lifestyle diseases. Lifestyle diseases are the ones that are going to be the biggest problems right now. Immunity, obviously, as we've seen in COVID, has been a huge issue, and nothing seems to have wonderfully addressed the COVID situation as traditional medicines, especially Ayurveda. And in Tamil Nadu, even the Kabasura Kudnir has really helped in the curbing of the disease. The other lifestyle diseases like cardiac problems, fatty liver, and the liver is a problem that has actually the government of India has added it as one of the big four of the non-communicable diseases, and that's something that Ayurveda has got wonderful solutions for. And the last thing that I want to touch upon, because I'm very, very conscious of the time for the other honorable members as well, is to make sure that we as a community practice integrative medicine. I think that's been the common theme from all the speakers so far. Let's not throw the baby out with the bathwater. Let's use allopathy where it's absolutely required, and let us absolutely not shy away from Ayurveda where you actually think Ayurveda is going to be the primary way of treating a person. Thank you, Dr. Natesh. Thanks for the opportunity, and thank you, Akram, so much for having me on board. Thanks.
Thank you, Dr. Jami. That was so clear, short, concise, and again, very informative. And thank you for reminding us integrative medicine, I think, like you said, is the way to go forward. And very interestingly, in allopathic medicine world over, we have moved from communicable diseases to non-communicable diseases. Like you rightly said, non-communicable diseases are lifestyle diseases. And it's very important for all Ayurvedic practitioners to recognize and treat that. It is allopathic medicine has started the shift from reactive medicine to preventive medicine. And I think Ayurveda also should start practicing that. Having said that, one of the important points which keeps coming to my mind is somehow we all should try and promote awareness of Ayurvedic medicine, which I think is lacking. People now, like Dr. Tripathi said, that's the traditional, that's native medicine. That was what was available in India, I think, years for generations and beyond that. So we should all, Policy Times will take a decision and we'll try our best to promote Ayurvedic medicine and create awareness about what benefits it can actually give to patients. Thank you, Dr. Jami, again. I now invite Mr. Kanhaya Mandal to share his view, the industry perspective, as Akram calls it. Sir, the floor is yours.
Yeah, good evening. Thank you, Natesh, sir, and thank you, Mr. Akram, to inviting me in this forum. I am having very gratitude for all these distinguished members and chief guests who given some light upon this Ayurveda medicines and something that is going on to appreciate this industry and to get it more popular for the health and well-being of the people at large. We have also seen that our Upadhyaya sir told that in Sikkim they want to have one good institute over there. And I was there in Sikkim for 15 years. So I have seen the atmosphere and the working culture. What it is there, because basically I have worked in allopathic medicines only. Since last 1.5 years, I am working with the Ayurveda medicines. Only difference that I can tell you that while I was working in allopathic medicines, I never used to take my own medicines. Just we were making the medicines for the others. But while I am working in a Ayurveda factory, so I used to keep some medicines in my drawer as well. And on regular basis, when I am going on the shop floor, so testing of medicines means by taking the medicine for me itself. That is the difference between the Ayurveda medicines and the allopathic medicines. Dr. Jairam Hajra sir very significantly, very pointedly, he told that there is some quality aspects which need to be addressed. So I can tell you that while I had done the pharmacy, at that time I studied that how the GMP evaluated from. So GMP was not evaluated from the regulatory body. It was evaluated from the industry itself. So more and more industry will propagate, the quality system will definitely it will come and it will take into the place of any adulteration. The problem with that this Ayurveda medicine is that all the raw materials are the herbs, which are the geographically based components are there. So to test in a laboratory, it is very difficult. So I'll discuss something more about that. Some of our earlier guests also told us that there are some prerequisite and something else that is required to establish something. So for industry point of view, I may share you something which may not take more than 2 to 3 minutes. So let me allow to share my screen.
Please go ahead, sir. Please go ahead.
Is it seen to you, sir?
Yeah, we can see it. Please go ahead.
Sorry, it is not moving. So, sorry.
You can make it full screen, Mr. Kanaya.
Yeah, screen is moving now.
Yes, it is.
Yeah, so already it has been discussed that the traditional medicine, which is the Ayurveda, Unani, Siddha, these are the three medicines which is frequently used. Rowa Sigpa is another type of medicines. It is a Himalayan drugs. There is one university. It is situated in the Ladakh. About another one I am not aware. It might be something somewhere there. So another one we have seen that homeopathic medicine is also very much popular in India. However, source of this homeopathic medicine was in German, and it was initiated in 1796. And we also know about the Chinese system of the medicines. So for the background and all these things, these Ravindra Tripathi sir already discussed in the detail. So we will not go up on that one. So we already know this is the oldest form of healthcare system. And even these modern medicines were derived from this natural source only. We know that Ayurveda and Unani, what it means for the healthcare. So it has also been this holistic approach that we have discussed and it has been elaborated in detail by our previous speaker. So we will go to another one. that we have seen that Dr. Jairam Hajra, who has come from the NRIDD and CCRS, these are the pioneer research institute from the government of India. And today, these IMPCL is the contribution from these institutes only, because the manufacturing of drugs and the research, it was very closely coordinated by these institutes. So at number 6, we see AIA. This institute has been, it is operational in the New Delhi. It is same as AIMS, what we are seeing in terms of the modern medicines. And recently, the NIUM, the National Institute of for the Unani Medicines, it was inaugurated in the Lucknow. And there are so many government hospitals for which the these Ayurvedic medicines and means these traditional medicines are being used over there. So all it comes under the government of India. This is for the Unani. This for the Unani, the Center for the Research in Unani Medicine. Anything else, sir?
No, go ahead, sir. Go ahead.
Go ahead.
Because I some this it comes, I doesn't know how it comes.
No, please go ahead.
So,
please go ahead.
Yeah. So for these, even the governments and some regulatory bodies are also taking care of these medicines manufacturing. So for any manufacturing medicines, we need the global marketing. So there is a WHO GMP certification is required. IMPCL is certified in terms of that one. For marketing in India, only GMP certification is required. Licensing is must for which we want to manufacture any product and distribute to the public. We had also some of our these previous speakers told us that there is a differences in the classical and proprietary medicines, where he asked that some funding is required for the research of these Ayurvedic medicines. I am pleased to share that a few months back, I have seen that Ministry of Ayush has greatly promoted these Ayush medicines. He has already fund to for the manufacturers, even for the even private sectors also. Even they have someone want to set up the laboratory, they want to upgrade the laboratory, they want the certification of the WHO, means some financial aid is also government is giving to promote the Ayurvedic medicines manufacturing. So critics and shortcomings will be there, like what the Hajra sir told, that in Chavanpras, someone who is using aloo, someone who is using this kaddu, something. These are the things, because the problem is that we doesn't have the testing procedure exactly, because in Chavanpras almost 45 to 46 herbs we are adding in that medicines to manufacture that product. So how to identify the individual products, individual ingredients? There is no established procedure over there. So quality policy, we will not discuss over here. So to manufacture any products in this Ayurveda and Unani, so there are some reference. This is not the only reference books, but there are so many books available with us to which we are manufacturing any classical medicines. For any proprietary medicines, the people are doing their own research and establishing their formula. So API means Ayurvedic Pharmacopoeia of India. It was initiated long back. But actually, the working on these details of these raw herbs, minerals, and pharmacopoeial estimates, since last 1 or 2 years, the committee has started very seriously working over there. And very soon, means earlier there was a part 1, now in terms of part 2, the formulation and analysis procedure also given there. So someone, if you want to initiate with any industry, so these books are the simple reference book for them, and word by word they have to follow them. So we will not go one by one. This is the things that we are following. Now, what different formulations we have in the Ayurveda, or means very in traditional medicines which we are manufacturing in any industry. So it is a tablet, pills, and putty. So we have seen that tablets and all these things in the allopathy medicines it is a very established procedure, but it is not in this one Ayurveda. So they are following this modern medicine itself, and gradually it is being standardized. And for the future, there will be the good procedure, and the patient compliances will be there. So the another last one is there. What is the business prospect and the possibilities for this Ayurveda medicine? So typically, this is the example for my own company. The last 10 years, it's the sales data. So we have seen in after the pandemic, this one COVID-19. So the productivity has been increased by leap and bound, and so the profitability of this company. So that is all about of this business opportunity in this one. So with this only, I would like to conclude my slide. And if anything else for the on a personal basis, then I may answer that one. So thank you, sir. That's all.
Thank you so much, Mr. Kanya Mandal. Very elucidate presentation about the regulatory controls. And for all our audience here, I want to say, if you want access to the presentations of our different speakers, get in touch with us at Policy Times, and with the permission of the authors, we'll be happy to share them with you. I would like to go cross-border now. We're trying to, Policy Times, very keen on building Ayurvedic relations with our neighboring countries as well, especially Nepal. Wow. Can I request everyone to mute, please, so that our speakers can be heard? Can I now invite Dr. Pradeep? Are you there, sir? Dr. Pradeep Gyanwali? Yes.
I'm here.
Yeah, from Nepal. Can I invite you to say a few words, sir? Thank you so much for joining us, first of all.
Yeah.
Go ahead.
Thank you very much to the organizers, especially Akramji, Policy Times, Chamber of Commerce, and the Nateswalaji, and especially our chief guest, GP Padhyaya sir, Cabinet Secretary, and all the participants, dignitaries from different institutions and companies. Actually, it's my privilege to be here with you to discuss about something about the Nepal Health Research Council. So that is the apical governing body for the research and the study in the country. So actually, it is there to establish some policy level guidance to the Nepal government through the research and the research-related activities in the health. And it's an apical body. So actually, it has mandate to do research and to promote research in the country. So it's an apical body. And the research policy and research priority that is set by Nepal Health Research Council, that is related to the Nepal health policy. Yeah. Actually, it has 4 different mandates for the research governance in the Nepal, like the most important mandate being the ethical regulation in the country. So that's why we have ethical review board in the center, and that is led by the independent research scientist, and we have institution review committee in different medical colleges and the institutions. So that are taking care of the research activities in the country. And second being the capacity building. So we are training different types of technical persons in the health research as a capacity building, like different trainings. And actually, we are planning to have just master's PhD program in the research also. So that's why we need some collaborators for the academic activities in the country. And second, the third being the evidence generation for the health, and fourth being the promoting use of the evidences. So one of the objectives of the council is to work on the traditional medicine and the Ayurvedic medicine. That is the objective of the council. So for that purpose, we have one of the in the representative of the board. So there may be the research scientists from the Ayurvedic background also. So that's why it's important for us to discuss about the health-related activity through the in the Ayurvedic and traditional medicine in the country. So that is being emerging in our country. And actually, I am clinical pharmacologist and a drug specialist working in the institution like Nepal, one of the biggest medical college in Nepal. So I am a clinical pharmacologist and professor of that institute. So being a pharmacologist and drug expert and an executive of the Nepal Research Council, it's my role to promote Ayurvedic and traditional medicine research in the country. So we have the renowned, one of the renowned scientists from the different Ayurvedic and clinical research background in the country. We are working on the clinical research capacity building activities in the country, especially during COVID pandemic. We have tried to establish clinical trials and RCT design and the hospital-based study, and including the clinical trial of the Ayurvedic medicinal products like ST, Modu and Trikatu combination. So we have tried the clinical trial of the Ayurvedic medical product also. And we want to establish such type of different types of labs and having the international type of standards lab for the genomic and biomedical and the precision medicine center as well. So we are working on the clinical background. So we have very much rich in the medicinal plant. So you have, so if you see the different medical medicinal plants in the country, we have high altitude medicinal plants like if you see like Jatamasi, if you see Yarsa Gumba, so that is one of the very potential for the anti-cancer molecule, and then like it works like seedless hamid also, yeah. And we have different types of medicinal plants for the psychoactive disorders and anti-cancer activities also. And Taxus bogata, paclitaxel. So that is developed from the Taxus bogata. So that is the original source is the Nepal. So I have one of the international scientists in research in the Nepal Council, Vishnu Marasinji. So he will tell you something about the different types of possibilities of the medicinal plant activities in the country. So I'll give time for two or 3 minutes. And as an organization leader, so what I want to tell you all people that, so there are so many scientists or some leading organization leaders also, and like industry people and the policymakers. So I want to meet the secretary also. So I wanted to meet to secretary when I was in the Silgari, but I could not manage the time. So I request Akram that, so as a national leader of the research in the country, so I want to meet you people officially. And I want to tie up you officially so that we can do so many things in our country regarding the Ayurvedic and traditional medicine in the country. So you are mostly welcome. We want to have some collaborative partnership, like public-private partnership can be done through the council as well. So there are some of the pharma companies in the Ayurvedic sector that they want to establish R&D in pharmaceuticals related to the Ayurvedic sector. So that's why, yeah, it's very fertile line. We have fertile line to work on the R&D in the Ayurvedic medicine and traditional medicine sector and minerals also. Like we have Shilajit, very much well-known drug like Shilajit, yeah. So that can be researched also. And we can show to the international level that we can do so many collaborative activities, as well as like not only for the research, you can plan some of the RCT design also, randomized control trial, and that can compare to the clinical or allopathic medicine to the Ayurvedic medicine also. So that can be the possibilities. So we can work in many ways. So that's why I request all personalities and dignitaries to work together on behalf of the council. We are ready to work together. So that I wanted to know, communicate and work collaboratively. So what I wanted to inform you that we have already done MOU, Minister of Understanding, with ICMR, Indian Council of Medical Research. One of the component of that MOU was the work on the research and the study related activities on the traditional Ayurvedic medicine, so that we can work directly with the institution. If you have MOU, because ICMR and the NHRC are the government organizations. So if you tie up according to that MOU, that will be very much easier for us to work further also. And I met the Ayush Secretary in Delhi. So when I was there in the conference of the World Ayurvedic Congress in India. So we can do so many work related to the Ayush also in the traditional medicine and the Ayurvedic medicine. And I again thank you all, especially Akramji, for inviting me and giving a chance to say something about Research Council and the possibilities of the research activities related to the traditional medicine. And I want to know, I want to share one of the information that we have MOU, going to MOU or agreement with the Harvard Medical School Genomic and Precision Medicine Center. So that is one of the component of that agreement is the pharmacogenetic study. So we want to establish such type of research activities by working with the Harvard and genomic and precision medicine activities. So that we can work together. So yeah. So I'd like to request to say a few words regarding the medicinal plants in the country. So you'll take 1-2 minutes only.
Thank you very much. we have done some isolation of pure compound and evidence generation and standardization of drug, as well as clinical trial of Ayurvedic formulation. For example, fenugreek is in clinical trial for diabetic patient, ST, the Jethimodu, and also NHRC as well as Nepal Academy of Science and Technology was in collaboration with CSIR Lucknow, India, who has isolated Taxol from Texas Bokata of Nepal, Nepalese origin, and as well as the a drug which is very potent for Kalajar is isolated from Delphinius azacis, which is patented on Canada as well. So therefore, we hope there is very lots of possibility to work on Ayurveda. Thank you very much, as Dr. Prabdeep Gewari said.
Thank you.
Yeah, thank you, sir. Thank you.
Thank you, sir. Thank you, Pradeep Janwali, sir. Thank you for that nice talk. And let me assure you that Policy Times will facilitate your meeting with all the Northeast policymakers for sure. Right? And we are very, very happy.
Yeah.
So I request all, please arrange one like meeting in Nepal, in Kathmandu.
We will do that, sir. We will discuss that. We will take that offline. We will have a separate discussion on that. Definitely.
Yeah, thank you.
Yeah, thank you, sir. Thank you so much for that. And now we have a couple of very important speakers. Can I invite Mr. Kuniram? Sir, are you there? Professor Kuniraman?
Kuni sir, if you can please unmute yourself.
I think we can unmute him. Ask to unmute. Can we unmute?
We are trying actually.
Okay.
Somehow his system.
Okay, can I then go on till we get, can we go on to Mrs. Preeti Madhavachandran?
Sir is online now. Sir, Kuni
sir is online.
Yeah. I think there is some
technical.
There is some technical issues. I don't know what happened.
So we can hear you now, sir. Please go ahead.
Good evening, sir. How are you, sir? I know you from Kerala. So you also knowing me. I mean, we had a long discussion about this 3 years back. So So, sir, I am Dr. Ayan. I was there in Kollam. So we had a discussion for a long time. I mean, 3 years back, I met you and discussed about this one. How to promote the same thing there.
I could recollect that. Thank you for recollecting all these memories.
I used to work full-time medical college, sir. And I was metro scan both the way.
So I can recollect.
Only one.
We are very late. You know.
Yes, sir. Please go on, sir. Please go on.
Yeah. Only 2 points I would like to share. That is the post-COVID era globally demands us to have a paradigm shift. So what is the urgent matter is that we must have a very stringent policy of in all aspects, even academic, non-academic, pharmaceutical, and all aspects. We must have a paradigm shift, and also the priority must be. Some speakers were referring on that. Our priority must be R&D also. That is one point. And second thing is that instead of holistic, we were using the word holistic. We would stress on the way of integrating all the streams, and give and take, whatever it may be. We have too much integration of all the streams. And as you know, I represent a snakebite treatment center started years back, where as everybody knew that we treated snake, integrating modern and also Ayurveda. So that is the USP of our organizations. And we have a plan of starting this integrated treatment of snakebite patients through telemedicine. We have a project on that. We have already discussed with the central government, and also we are planning to have a discussion with the state government also. Telemedicine treatment to snakebite patients wherever it is, all over India. And it is I am very much delighted that Nepal, the head of the Nepal fraternity has been already offered support for traditional medicine and also Ayurvedic medicines and hospitals, etc. We hope that we can join together. And next year, we are planning an international summit in the northern part of Kerala, that is my district, Kannur, southern part of India. So I initially welcome all of you to participate in the international summit. Naturally, we are planning that by the end of this year. That only that much I can share in this very, very late night. Thank you all.
Thank you, Professor Kuniraman. Such wonderful words. Thank you so much, sir. We will get in touch with you to take forward all these projects that you have just said, sir. Thank you so much for your time. Can I invite Mrs. Preeti Madhav? Ma'am, are you there? Mrs. Preeti? I can see her there.
Yeah, ma'am is there. Yeah.
Hello, good evening. Am I audible?
Yes, ma'am, you are audible now.
Okay, sir.
Yeah, I know it's pretty late. Can we have a few of your words here, ma'am?
Yeah, sure, sir. Sure. Okay, sir. Let me introduce myself. I'm Dr. Preeti Madhav Chandran, and I would like to thank the organizers for inviting me. I would say that I'm partner in Rasayana Ayurveda Center. My hospital is in the suburbs of Ernakulam, Kochi, Kerala. It is situated in a very pristine surroundings, and it is an NABH accredited hospital. So basically, I can say that my connection to my hospital, though I am a doctor, I have a PhD, it's in management. So my connection to my hospital is as part of its administration and HR and the overall running of the daily operations. So I would like to share my experiences regarding the administration side of running an Ayurveda hospital. Actually, as I said, my connection to Ayurveda is through my husband, Dr. V. Madhavchandran, who is an Ayurveda physician. And he's the chief physician and CTO of our hospital. According to Ayurveda, I'm not an expert in that, but I would say that Ayurveda means a science of life. And it's a 5,000-year-old science, but a very actively practiced science. And it has a very high regard all around the world. And basically, as a theme, as global health, and I would say that we have a very good international clientele who is very much passionate about Ayurveda. We have people coming in to learn Ayurveda. We have people coming in to treat their ailment through Ayurveda. And also, obviously, what Ayurveda is, in a way, there is a thin line between serious Ayurveda and what we call as Ayurveda, the wellness aspects. So all these things are what we touch upon in our hospital. And our hospital is in a very pristine surrounding. So this is one of the very important aspects when you start an Ayurveda hospital. It should be in a very pristine surrounding, very peaceful. So because most of the people who come here, they come here for ailments and they come here for wellness treatments, fine. But at the end of the day, Ayurveda believes in the policy of treating mind, body, and spirit. So a pristine environment along with good quality treatment, good hygiene environment, good quality, as already the speakers have emphasized, good quality treatments, good quality and knowledgeable doctors, doctors with tremendous experience in the treatise. All those things are very important. And for us, we believe that our guest is very important. Whatever the guest says about their, problems and issues, we take a lot of care to correctly understand, diagnose it. Our doctors try to understand this. Our chief physician is very particular about that. We give a lot of importance to the learning about what are what exactly is the issues with our our guests, whom we or our patients. and customizing the treatment. All those things are very important. Punctuality is another very important thing. Quality of treatment is again very important thing. And actually Ayurveda has divided into 7 aspects, categories, which again I don't need to emphasize because we have experienced persons who are part of it. But I will just say that it is internal medicine, gynecology, pediatric, ophthalmology, surgery, toxicology, then geriatric psychiatry. So all those things, when you start an Ayurveda hospital, all these things can be included as departments in your hospital. You can include well-versed, knowledgeable doctors for all these departments. We too have a few of these departments in our hospital. Then regarding the administration, interacting with a patient from the time they land in our premises, then making them at ease, settling them down, then all those things are given prime importance. Communication with the patient is also of prime importance, because most of the time they believe that most of the people want listeners. So all those things are what we emphasize on. And in our hospital, we have the medical department, we have the administration department, and we have the HR department. Then there is accounts department, because handling the we have international clients, we have domestic clients, so handling all these things are very important. So we require an accounts department. Then we have a diet kitchen to customize the food for the patients. Then we have housekeeping department, security. So all those departments are what holds an hospital together. It is basically a team play. It's a team. Everybody in a hospital has to synchronize and work together to make an hospital into the quality or the goals or the aims, which or the vision, to meet the vision of the hospital we are setting up. So all these things are in brief what I want to say. And in Kerala, I think majority of the doctors are ladies, and in our hospital also we have around 60% of our employees are ladies, including our doctors. We have seniors, chief physician and senior doctors who are males, including my husband, Dr. Madhav Chandran. Along with that, we have lady doctors. We have good masseurs of high quality. We mentor them, we give them training. So all those things are the factors we have to look into. And also we have to look into all the statutory norms and government rules regarding hygiene, regarding certification. And so it's not easy as such to run an Ayurveda hospital. It's as tough as running an allopathy hospital. So this is what I want to emphasize, because people feel that Ayurveda has a concept that, okay, people come for a spa or people come just for a massage and all those things. But no, Ayurveda is, and especially we too are into serious treating of serious illness as well as the wellness part. So emphasizing on quality, emphasizing on hygiene, emphasizing on good doctors, good knowledgeable doctors, senior doctors, teamwork, benchmarking yourself, standardizing the procedures and systems, emphasizing on even the minute parts of the daily operations. All those things are very important as far as an Ayurveda hospital is concerned. It is as good and as tough as running an allopathy hospital, because we require an NABH certification, we require ISO certification. Money again is a mandatory part. We require marketing to be done. So these are some of the things which an Ayurveda hospital requires. And I think my experiences cannot be shared in a very short or a brief stint. It is a very, it's a daily interaction. It's very, you deal with the different kind of people, different nationalities. So it's varying. You can't predict that you have 10 patients, you're done well. No, the other 10 patients which come will be totally different from the experience which you had. So all those things are very important. All these things have to be kept in mind while dealing with an Ayurveda hospital or running of an Ayurveda hospital. And of course, medicines, all those things are important. Bringing in, if you manufacture your own medicines, fine. Otherwise, I think it would be better if you include a standardized, I know there are a lot of manufacturers who bring in, who have standardized medicines. So opting for those things and all are very important. So I think these are a few of the aspects or the experience which I can share as the administration aspects and HR aspects of and running an Ayurveda hospital. Maybe if there is more time, I could have shared more personal experiences, because every day is a different day for us in an Ayurveda hospital. But in overall, it is it's a beautiful experience, because at the end of the day, when you get a good feedback from your patient who's recovered, who tells you, yeah, I came here, I'm very happy, I'm de-stressed, I'm not only cured of my illness, but I'm de-stressed, I'm very happy, I'm more happier to face the world, go back to my work site with a better frame of mind, motivated. Wow, that is one of the best things which I feel is part of my job, which gives me happiness. So I think this is in brief what I can say about running an Ayurveda hospital. And in case of any other detailed, you can always contact me. Thank you.
Thank you so much, Dr. Preeti. That was a wonderful explanation of how you're running a Ayurvedic hospital. Indeed, I believe that India, it's high time that Ayurvedic hospitals also go the corporate way as more adoption happens. Just like allopathic chains of hospitals, Ayurveda also has the potential to go corporate and become chains. And the way you are going, madam, I can assure, and we very confident that you probably will be the first to set up a chain of Ayurvedic centers, and Policy Times will be very happy to support you in that venture. So I think we've come to the end of the speaking session. It's already been very late, but somehow I feel the time has been so consuming because of the wonderful quality of the speeches we have heard. So I now throw the floor open for a few more minutes for any questions, because I see a large audience, still about 50 people. We had more than 100 people initially. 50 people still patiently there. If any...
Please unmute, sir. Sir, please unmute yourself. Sorry.
Oh, so sorry. Okay. So anybody can ask questions now to any particular speaker, or generally we'll get someone to answer them for you.
So you can either write in the chat box, or you can also, with your voice, you can ask the question. Anyone, if you would like to ask.
Hi, my name is Prahalad.
Hi, sir.
I'm from Chennai.
Go ahead, Prahalad.
I have a question for any doctors in general, and particularly to Dr. Jammi. Do you have any pressing diseases right now that can be addressed only through Ayurveda?
Dr. Jammi, would you like to take that?
Yeah. I would actually. So this is a very interesting question. There is a book I wrote over the COVID time, and it's called The Orphan's Father. This specifically deals with diseases that have been orphaned by allopathy, but have solutions in Ayurveda for a very long time. And one of those diseases that is now having a huge impact in the Indian society is cirrhosis of the liver. Ayurveda treats it very, very well. People as late as stage 3 cirrhosis have been reversed. Again, this is something that is very, very surprising to a lot of people, that especially the Western scientists and allopaths, where they say that cirrhosis has no cure and the only way to address it is using a liver transplant. But that's not true. We have our own clinic here in Chennai where we've treated several cases of cirrhosis, reversed them successfully. That's one disease. The other one, migraines. Migraines have irritable bowel syndrome, fatty liver. I mean, there are a lot of diseases. My recommendation, Mr. Prahalad, is for you. It's a shameless plug, but please buy the book on Amazon, The Orphan's Father. I wrote it a couple of years ago, and it addresses a lot of diseases that can be cured by Ayurveda that allopathy does not have solutions for.
Thank you very much, Dr. Jammi. I see another question from Manbir. Thank you, Prahalad, for the question. Manbir, can you? Yeah.
Yes. So good evening, sir. Thank you for lovely insights. My question is regarding the insurance sector. Like if we are talking about taking Ayurveda to the corporate level, at policy level, we also need to inculcate the health insurance sector to incorporate more policies that can give people the insurance coverage for even Ayurvedic treatment. Because when I researched, most of the health insurances only give reimbursements, limited reimbursements. They do not cover hospitalizations. So, in order, if we want to give it a universal approach, I think our policies should have more health insurance coverage.
That's a beautiful question, Manbir. I think it's very insightful.
I'm having one thing, like according to the question right now, that policy, that insurance coverage, usually in some part of a different area of hospitals in Ayurveda, they are getting coverage for IP patients if they are getting admitted in some emergency basis, like severe fistulas problem, severe pain, back pain and all those. So they are getting admitted. For that, they are getting that kind of insurance in that way, emergency basis admission, and they are getting the insurance coverage, the complete one. And if it is like a stable one, but chronic one, so that policy we have to, like, universal policies to make and to approach in that way from our side.
Oh, thank you, Dr. Ayan. Can I also invite Dr. Preeti, who is already running a hospital? Can you take this question, Dr. Preeti? How does it work in your hospital? Do you have insurance coverage?
Yes. We do have insurance coverage, but as it's already mentioned, it is reimbursement. Because most of the insurance policies, unless you have even if you have an Ayush policy in your insurance policy, it is mostly reimbursement. There is no cashless policy as such which has come into existence. So this is what we have been trying to cover. And most of the, almost all 99% of the insurance companies are reimbursing they are reimbursing all the amount for Ayurveda treatment. In fact, I think only some companies, maybe some around 1,000 rupees or 2,000, depending on your policy, they cut. Otherwise, most of our patients, they have been getting almost the entire amount. And but the thing is, you have to first mention to your agent that you will be going for Ayurveda treatment. So it starts from there. So that is the first thing you have to do. The first stepping stone is just inform your agent or your company that, okay, I'm going for Ayurveda treatment, and then
we can get a reimbursement. Okay. Thank you. Thank you so much, Dr. Preeti, for that. Thank you so much. Akram, I think we should make this a point, and we should take this up with the insurance companies. Manbir, thank you again. Very interesting point. And we will definitely, the Chamber of Commerce Policy Times will take it up with the heads of insurance companies, and we'll see what we can do to push this. One more question from Samir Jamacha. Can you unmute and talk, please?
Thank you for giving the opportunity. So I'm from the far of everyone for the northeastern part, Tripura. So
welcome.
Actually, I'm working for the long time from study from in China also. So I'm my suffer. There is basically I've developed the leaf tea, everything. So our side, and from the by born to by born, my forefather, the lot of we have developed. Now I have developed the practical example I given the bamboo leaf tea. Okay, so I have so many right to the FSSS, and then so there were no recognized like. So Ayurveda office also the Agartala, their officer also I'll meet. So there also tell me. We need the Kolkata, you go to the blah, blah, blah. So, but we have the forefather to forefather in China also, everywhere you take. Then there is the very nice silicon of the bamboo leaf. Everyone study. So that have kind of now recognized the Ayurvedic system. So what time they recognize, what time the so many sort of if
Sure.
a sort of time you take not to given the explanation. So that why the you think our side of lot of the Veda system we are called the forefather of traditional method. We have the village level we treated. No, nothing that we take that. So that was the main basic thing. There's the example for the simple example. So lot of the no recognized for the FSS those FSS, and then somewhere insurance like so that so that was the what hello.
Can everyone mute, please? Yeah. Okay. Thank you. Go ahead.
So please you see that this matter of the base basically for the and attached for the enclosed for the Voiddo, our village level Voiddo, lot of the Voiddo till now no recognized, but in the forefather to forefather we have the practitioner. So
Okay,
that
thank
was
you.
the
Let's keep
thank
the
you.
question short. What actually Mr. Samir is asking, there are a lot of, traditional Vaidyas, like village, quack doctors, you can say, then they are not certified, neither they are approved or authorized. So he is requesting, is there any process of like recognizing this hundreds years of their practice and growth? So what would be the answer to this? Our reward. Maybe Ravi sir, give it try.
Hello.
Please unmute,
Yes.
sir. Or Jairam sir, please.
Actually, each and every state having their own Ayush drug controlling authority. First, the person who is doing the work on Ayurveda or folklore medicine or traditionally, they are using the medicine from forefather, that should be submitted to the state drug controlling authority for taking the license first. And if we have a totally unknown medicine other than Ayurveda, and it is not mentioned in Ayurveda, then it can be taken for patent. First, you take the patent, apply for patent, and you will get the patent. Otherwise, you have to take the license for preparation of Ayurvedic medicine from Drug Controlling Authority. Am I
Very
clear?
nice. Yes, sir. Thank you so much, Dr. Jairam. That was indeed very clear. I request Samir, if you need more information, please do get in touch with us at Policy Times, and we will try and get you more information on how to go about doing this. Thank you, Samir, for the question. Is there any other question? I don't see any raised hands. So, Akram, I think we should have closing remarks because it's already 2 hours now.
Right, sir. It's almost 2 hours. 2-3 questions. Now, there are some entrepreneurs. So, one with regards to medical college. So, someone wants to start a private medical college. What is the approach? What is the minimum land requirement we have? And then what is the overall planning to start a private medical college? That is one question. The second is, there is potential of Northeast and Bengal to be a wellness hub or Ayush tourism hub. Now, how do we start? Where do we start from? So, Jairam sir, maybe if you can, and Kuni Raman sir, if you can also come in, and Ravi sir is already here. Where do we start? If an entrepreneur has 4 bigha of zameen, land, then how many buildings do we?
We can start only hospital. Within 4 bigha jamin, no college will be permitted from CCIM, because CCIM, Central Council for Indian Medicine, is the sanctioning authority, recognizing authority for starting the establishment the college. So first you have to approach to the CCIM for establishment of college, and for that minimum, probably presently minimum 5 acre land are required, as per my knowledge, for establishing college only. But for establishing hospital, 50-bedded hospital, 100-bedded hospital, you can start anywhere. There's no problem. Definitely, at present, as per Ayush Ministry, it is Ayush NABH. You have to maintain all the guidelines of Ayush NABH. It should be maintained properly.
What is the ideal thing to start with, sir? Is it a wellness center, Panchkarma? Where should, because no one would be willing to invest a large amount of money at the first go, but somewhere there are some interested
Initially, you can start wellness center, then Panchakarma center. Panchakarma center is a super specialty center. For Panchakarma center, we need only very less land only. I mean, within 1 bigha, you can start also, because it's like a clinic, and you can start also Panchakarma hospital only. Yeah, Charasutra hospital. The Charasutra is 100% result you can get. Even Panchakarma also. It is very popular in Kerala. And why not in Bengal? So if you start in Bengal, and especially in North Bengal, then it will be a very good thing for Ayurvedic hospital or Panchakarma Institute, Panchakarma Center, Panchakarma Hospital, or Charasutra Institute, Charasutra Center, yeah, Charasutra Clinic, or Charasutra Institute also. So we have two fields. One is Panchakarma and one is Charasutra. Charasutra means Karsutra. So good thing, we can start immediately. And Ayurvedic hospital having all the departments, that will take time. We need a maximum facilities for, suppose, for cellular department, for cellular means surgery, department, for Kaya Chikitsa, for medicine department. So for them to start all these departments, I mean, to start the hospital, we have to follow the guidelines of NABH. Definitely, I use NABH, not modern NABH. Am I clear?
Excellent. Yes, sir. Very clear.
Ravi, sir.
Yes, sir. Sir, actually, I want to tell you something. When we are defining health and wellness, these two things are different. When we are telling health means merely absence of disease, but wellness means there will be social well-being, spiritual well-being, and physical well-being also.
Exactly.
So, and when you are telling about for the establishment or from where to start, so before starting, we must have a good vision and mission. So that means, suppose you want to start a hospital, 1 bigha jamin is enough, no doubt about it. But if your future perspective is to make it a college, then minimum 15 acres of land is required. Because at present, 3 different criteria are there. If you want to start a 40 intake college, then you need only 6 acres of land. But if the intake capacity is becoming 60, then the area will be doubled. So you can start with 1 acre of jamin, no problem in that. But there must be some avenue that it can be extended. So if you have to select an area where around 15 acres land you can acquire, then within that boundary you can start in 1 acre, no problem in that. One thing. Then second thing, if you start a hospital, you can start a super specialty hospital. You can even start with OPD and then it can be extended to IPD. There is no harm in that. But if you want to start a wellness center, then wellness center is little bit bigger than a hospital. That means if a person is coming, you have to give all type of support to be well, spiritually, then physically and mentally also. So you have to establish minimum Panchakarma center, one Kaya Chikitsa OPD or medicine OPD, simultaneously Khara Sutra, then some yoga center, then some spiritual talks you have to arrange. All these things collectively is called as a wellness center. So like that you have to start. So what I mean to say, and another thing is there, every day to day the CCIM regulation is changing. In that CCIM, I told that one ccmindia.org.in, one website is there where everything is mentioned, what you have to do, how to put the application. First of all, there the local university has to be approved. Then state government has to give the approval, which is called as LOI. Then after that, you have to approach to CCIM or NCISM. They have to give a permission to start the college. But before that, initially you have to give an application to start a college, and then you have to start a hospital. So that hospital has to run for 2 years. After that only you are eligible to start a college. So initially it can be started like a hospital. That is a clear-cut answer. Then depending upon the financial constraint, you have to think whether you can start a hospital or a wellness center. So anyway, college cannot be started all of a sudden. Initially, you have to start a hospital or a wellness center. Sir, is it clear?
Yes.
Yeah.
Very.
Thank you. I think thank you so much for to everyone for joining us and making the program such interactive and success. I will request our convener, Natesh sir, to give the closing remarks, and then I'll request Ayan sir to formally give the closing remarks. So Natesh,
Yeah, thank you, Akram, and thank you for all our dignitaries and all our audience. Been such a wonderful discussion all around. So I just want to summarize with few points what we've all agreed upon after this. The last time we had the conversation like this about healthcare in the northeast, North Bengal, we ended up in at least 2 MOUs and about 5 more discussions. So at Policy Times, whenever we have discussions, we always make it a point to note down action points for what is going to happen next, because we don't believe a conversation like this, a discussion like this should just get over with one discussion, but it should definitely result in concrete steps. And that is what something we are very keen to do that. And when we did it last time, we have got 2 MOUs signed. So I assure all of you that we will work very hard to make sure concrete, actionable items are worked upon, and at the end of the day, some result-oriented actions will be taken. And you can always get in touch with us for more information. So we all agree that the way forward, like Professor Kuniraman said, integrated medicine is definitely going to be the way forward. And last, most of the doctors here and scientists said R&D is very important. Maintaining quality of teachers and hospitals is extremely important. Maintaining the quality of medicines is extremely important. And we are going to work together to facilitate across state and across country collaboration. And to summarize the whole thing, and with my closing remarks will be Policy Times Chamber of Commerce will work very closely with anyone, all the entrepreneurs, the organization owners, and the scientists and the technical people. We will put together anybody who wants to work with other people, looking for collaborations, looking for investment. We will act as a nodal body, and we will support the growth of Ayurveda across the Northeast. With that, I hand over the thing to Akram and to Dr. Ayan. Thank you so much, everyone.
Thank you, sir. Dr. Ayan Chakraborty, sir, your closing remarks.
Thank you so much, Mr. Akram and Dr. Natesh, sir. And thank you all the dignitaries over here. And till we got all the points, and just in a nutshell, already Dr. Natesh sir briefed that. Just to add one more thing, as we have seen, Mrs. Preeti Madhavchandan, what she told, that to keep all the faculty, all the facilities in our Ayurvedic Medical College also, like all the units, like all the parts, like pediatrics, gynae, and all those parts. So that's an absolute fantastic idea, because we got, say for as a radiology, I got the opportunity to have to take a speaker part on MRI improvement for the people for Ayurvedic medicines. So like that, those is very important for Ayurveda part to make more CMEs, more workshop before whoever is going to put Ayurvedic Medical College or Ayush system in that area. So this is one take-home point that we are planning now. In a nutshell, I'm just finishing this, that we are on the making of the projects. First, starting with Wellness Center and Ayurveda Hospital, and then going to Ayurveda Medical College as early as possible. Number one. Number two, to keep there some manufacturing companies, who are making Ayurveda medicines or pharmaceuticals in Northeast, specifically Siliguri or Darjeeling or Sikkim, and R&D to keep as max as possible a max over there in that area. And apart from this, chronologically, another pharmacy college or Ayurveda related, all those research centers and other areas. So we will be projecting all this very soon, and max as fast as possible within next month. We are going to plan and project and finalize. Thank you so much.
Thank you. Thank you so much, Dr. Ayan Chakraborty. So with this, by thanking to all our respective speakers, Jaram Hajra sir, Ravindranath Tripathi sir, our ma'am Preeti ma'am, Kunia Raman sir also joining us, being with us here. Unfortunately, we could not have